Good morning. Continuation of the previous lecture. Uh, this is diagram showing gastrointestinal tract. This is food pipe. This is mouth, pharynx, food pipe passing through the diaphragm. This is diaphragm. Diaphragm is a layer that divides the thorax or separates the thorax from the abdomen. This is abdomen. It joined with the stomach. And then first part of small intestine, second part blue duodenum, jejunum, and then last part ileum. This is pink. Then start large intestine as a cecum, ascending colon, transverse colon, descending colon, sigmoid colon. Sigmoid means S. So here is assumed the S shape, and finally rectum, the last part of the large intestine. And the accessory organs of this liver, of this GIT system, this liver, this is pancreas, little bit below the stomach and little bit behind the stomach. A small tube come out of it with secretion of the pancreas, and another tube come from the liver. They both join and open into the duodenum. From abdomen start this. This is important. That's why I'm telling you. This is inferior vena cava going up through the abdomen. So all organs of the abdomen drain into the inferior vena cava, pass through the liver, and then goes into the heart. This is inferior vena cava. When it is passing through the abdomen, all the organs are draining into the inferior vena cava. But important point is it pass through the liver. This is liver. So if there is cirrhosis in the liver or there is fibrosis in the liver, it obstructs the passage of blood through the liver. So there is blockade here in the liver, and this inferior vena cava, blood in the inferior vena cava cannot go past the liver. So there is back pressure. When there is back pressure, this pressure goes to the small veins in the rectum. These are the rectum. So these veins become dilated, they can bleed, they can give pains, and these dilated tortuous veins are known as hemorrhoids or piles. And one of the reason I told you, blood should go up to the heart, but it is blocked here in the liver. So there is back pressure, and due to back pressure, these veins in the rectum, they are dilated, and this is known as piles or hemorrhoids, and they bleed and they are painful. The operation to remove them is hemorrhoidectomy. Another important thing is this is esophagus, and in the last part of the esophagus there are small veins like in the rectum. They also drain in the inferior vena cava. When inferior vena cava is blocked in the liver, these also get dilated and tortuous. These are known as esophageal varices. When blood is not going through the liver, blocked, back pressure, due to back pressure, these veins in the esophagus, they dilate. Their valves break. And these are known as esophageal varices. When they bleed excessively. They bleed excessively. It can be fatal even. Number 3 point which I want to tell you on this diagram is, this is esophagus coming and this pass through this hole. This hole is known as hiatus. Sometime what happens is, the hole in the diaphragm is larger than the size of the food pipe, esophagus. So there is some space like this. There is some empty space. So part of the stomach can go through it, or part of the large intestine even can go through it, like this. So when you take X-ray, you will see a part of this green part which I have shown you. It passes through this hiatus and gone into the chest. You will see a part of the stomach or part of the large intestine in the chest. You can see in the chest, in the extra chest. This is known as hiatal hernia. Hiatal hernia. Something has herniated out through a hole or aperture which is known as hiatus. That's why this hernia is known as hiatal hernia. Hiatus hernia. This was what the 3 points which are. Another hernia, yes. Another hernia is here. Due to chronic cough, due to bronchial asthma, constipation, when we apply pressure, the pressure is transferred to these vessels. So they can dilate and become hemorrhoids, or there is a potential hole in inguinal area here that can open, and a part of intestine can herniate out and it will go through the genital area. This is part of small intestine, but it could be large intestine or anything, small or large intestine. It will pass through the inguinal canal and go towards the genital area. This is known as hernia, inguinal hernia. This area is known as groin. So hernia in this area is known as inguinal hernia. So inguinal hernia, hiatal hernia, and esophageal varices and hemorrhoids. These are the 4 things which are important on this diagram. And the 5th is colostomy bag. Thank you very much.